We start with a drawing. We divide the upper lip in two, and then each half into three with 2 points in the upper lip, one at 1/3, another at 2/3, and one more point in the lower lip at 1/3. After sterilizing the area, the patient opens their mouth to insert our non-dominant index and place it just on the wet red lip. We then introduce the needle, which will touch the pulp of our index with its tip. And we inject slowly RHA2, 0.2 milliliters per point. This will everse the lip. It will create a bump under the mucosa, under the wet red lip, far away from the border between the wet red lip and the dry red lip. Then the fourth step is to do the same for the other points of the upper lip. Each time we inject 0.2 or 0.1 milliliters of product, depending on what result the patient wants. We do the same for the 2 points of the lower lip to create the 2 bumps lateral to the midline. These 6 bolus points are very safe with regards to the arteria labialis position. There is no artery under the wet mucosal side of the red lip. We do the same on the other side. When we finish, we have 6 bumps under the wet mucosal side. Following injection, massage the bumps. We use RHA2, which spreads easily. The patient must never leave the office with a bump that can be felt with a finger. The advantages of this technique are that the injection is not painful because of lido and white lip introduction, and it's easy to crash because of RHA2. Here is the outcome.